If you do find out that you have the early stages of macular degeneration, we can get you on a regimen of lifestyle modification, which means if you're a cigarette smoker, you got to stop smoking. We know cigarette smoke contributes to the advanced progression of this. Getting you in ultraviolet protection when you're out in the sunlight, ultraviolet sunglasses specifically. And probably the biggest is nutritional supplements and changing your diet. We know that antioxidants, vitamin A, zeaxanthin, lutein, a combination of vitamins, as has been highlighted by the National Eye Institute studies, can really slow the progression and decrease the likelihood that people will really suffer significant vision loss, meaning losing the ability to read or drive or live independently. So that supplementation, when it started at those early phases, we know that that can decrease the likelihood that someone's going to go on to significant vision loss by 25%. That's what can be done about it in the early stages. For those patients who progress on to the wet form of macular degeneration, and that's estimated to be about 10 to 20% of people who have macular degeneration overall, the mainstay of treatment is a type of medication called an anti-VEGF medication, which stands for anti-vascular endothelial growth factor. This is an antibody that we inject into the eye that binds up the element that allows these abnormal blood vessels to form. So if we send in these antibodies that lock up that growth factor, it's not available to blood vessels and they shrink away, and the vision can be oftentimes restored significantly, sometimes back to the level that it was before those abnormal blood vessels showed up. There's a tremendous amount of research being done in the field of macular degeneration. With stem cells, we may be able to regenerate that cell layer that we know is dying off and becoming dysfunctional, and that may be the way we're treating this in 15 years.